Good afternoon, everybody. Good evening, everybody. This is Dr. Ron Swatzyna. A few corrections. Hearing some background stuff there. A few corrections. I run the Houston Neuroscience Brain Center, and I also am director and chief scientist of Clinical Neuroanalytics, a company that services about 20 some centers throughout the country in developing EEGs and quantitative EEG protocols and everything. Let me get to my PowerPoint and put it up here. Okay, all right. Let's get started. I wrote a paper which I did send to you guys and can be distributed in 2014. And it was about EEG and quantitative EEG technology that identifies neurobiomarkers critical to medication selection and treatment for children and adolescents with ADHD. And this is what I'm going to go over today. I've extended that study quite a bit, and we'll talk about the different neurological abnormalities that can create ADHD symptoms. Each one of these abnormalities actually requires a different intervention. So this was from my paper. I just put the table in here. And we have several different types of ADD. I also, as you guys as well, I've got ADHD myself and have been dealing with it most of my life. And it's taken me down some interesting paths, but I think it's helped me in the long run. Alpha is the timing frequency of the brain. It's how fast it processes information. When we're very young, our alpha is slow. As we age till about 13 or 14, it reaches its peak. And then about 68, my age, it starts slowing down again. So it's the circle of life. And slow alpha is an under-aroused brain. It's in children, it shows up as a maturational lag or very immature behavior. Now, this suggests that there is a deficit of norepinephrine in the brain. And so the amphetamine class of stimulants, your Vyvanse and your Adderall, would actually increase norepinephrine and increase the brain speed. Now, there's a lot of things that can cause a slow alpha peak, and we'll talk about this in just a minute. The next most common, or not the next common type of ADHD is a frontal midline theta. Somebody needs to be muted back there, please. Thank you. Can you find out who that is and mute them, please? All right. The frontal midline theta is it's an issue with the dopamine, and this is what we find in those that are very distractible. They have high stimulation. They have to have high stimulation to maintain focus, and this is most easily treated with the methylphenidate class of stimulants, whether it's your any of the methylphenidates, Ritalin, there's just tons of them out there, Concerta, but they hit more of the dopamine pathways in the brain. This is something that we find in those that play a lot of video gaming. So excessive video gaming can produce an ADHD brain, and if you're already ADHD, it will make it worse because this is the pattern that excessive video gaming plays and creates. The third type is a spindling excessive beta. These are over anxious individuals, usually overreacting to small provocation. They've got sleep maintenance issues. They're never really rested. And this is a type of ADHD that the alpha-2 agonists such as Intuitive, which is the old guanfacine, works. And the third type is a hypercoherent alpha type. This is an affect regulation issue. These are the ADHD kids and adults that will often get more distracted by their own thinking than they do by a butterfly flying by. And this would take the SSRI class, selective serotonin reuptake inhibitor. Now, what we find out is that there's several phenotypes that load into this. And what we identified is number one phenotype is focal slowing. Now, focal slowing is an issue where it could be caused by head injury, could be caused by stroke, it could be just a genetic or congenital malformation in the brain, but part of the brain is slower than other parts of the brain, and there's no way you can convince a medication to go to that one spot and leave the rest of the brain alone. So although you may help that one slowing in one part of the brain, you're going to make the rest of the brain too fast, and it's going to cause a lot of side effects. And this is where neurofeedback comes in. It's a very good method of treating ADHD that medicines really don't have a shot at. The spindling excessive beta pattern that we see, and endogenous just means it's just basically what a person is born with, but we also see it as being possibly connected to neuroinflammation. You heard of brain fog after people get COVID. Well, that's a neuroinflammatory response to the COVID, to any infection, any trauma, any head injury can cause that. And so a neuroinflammation may underlie a lot of ADHD, and it's going to take a completely different approach. Now, the sleep issues are also spun into this, because which came first, the chicken or the egg? If you're sleep deprived, you're going to be ADHD. If you got neuroinflammation, you're going to have sleep issues. One last thing to mention, though, is that the benzodiazepine abuse will load into this spindling excessive beta category, but it's at a different frequency, and we know which ones those are. So it's quite an interesting thing when you go delving into the brain about all the different things that can cause ADHD. For spindling excessive beta, neurofeedback or an alpha-2 agonist such as Intuitive, anticonvulsants if you really couldn't get a handle on it, and some people just need a sleep study to find out what's going on with their sleep. So again, we can't fight a sleep issue, and you're going to look ADD. It's more important to get the sleep established first so that you can see what's left. Are you truly ADD or just sleep deprived? The last one, the second to last one, is encephalopathy, possibly metabolic, toxic, hypoxic, or traumatic brain injury, or traumatic encephalopathy. We see a lot of metabolic and toxic and hypoxic issues. Case in point, I had two children, one 8-year-old and 6-year-old, both boys. Both of them had quantifiable, qualifiable ADHD diagnosed, and of course, they looked very ADHD. Well, one of them had tried medicines and had a terrible response, and the other mother had seen me do a presentation and said, "Why don't we try to do your study first before we put him on medicine?" I said, "I think that's a great idea." So we put we did the EEG, and it came back, and the doctor said it was, an encephalopathy case, and possibly metabolic, toxic, or hypoxic. So then it's my job to figure out which one. So after I went through my checklist of all the different things to ask, both boys had sleep issues. They were pretty skinny, but both of them never woke rested, and just weren't getting good quality sleep, the parents said. So I sent them both off to a sleep lab to get the sleep study. They came back from the sleep lab and they said chronic obstructive sleep apnea, and to refer to an ENT. Well, the ear, nose, and throat doc took a look at them, saw that it was affecting the growth of the brain, the development of their brains. And so he said, "I'll take the tonsils and adenoids on both boys." And he did. 3 months later, I did a follow-up, and the speed of the brain had sped up to normal rate, and the boys were no longer looking ADHD. And it's one of those cases where you can't fix a sleep disorder with a stimulant. In fact, it'll make it worse. And so this is one of those cases where we really need to find out what's causing the ADHD symptoms, because encephalopathy, we've had cases of a lot of mold down here in Texas. A lot of toxic encephalopathy from high mold counts in people, toxic levels of mold. And the metabolic, I found children that they didn't know, but they had, once we got the testing done, it came back as they had Hashimoto's thyroiditis. So it's just an interesting thing that we really need to see what could be causing these symptoms. And this you couldn't see if you didn't do an EEG and have it read by an electroencephalographer. The point is, you got to identify and treat the etiology, what's causing it first. Lastly, the isolated epileptic form discharges. Some people refer to this as silent seizures, but that's incorrect. It's not actually a seizure, but the brain has got these misfirings of groups of cells that can be caused by a wide variety of reasons. Toxins, infections, COVID, traumatic brain injuries, we just don't know. but this is happening quite prevalently, and I'll show you the numbers here in a little bit. Neurofeedback works well as anticonvulsants on this case. We've done tests, we've done studies where we've treated these with anticonvulsants, and it's found that one study in 2012 found 25% of children with ADHD have these isolated epileptiform discharges and recommended treatment with an anticonvulsant before you ever attempted to treat the whatever's left, meaning, use a stimulant. I repeated that study in 2015. I believe it was published, where we found 32%, but our population was children and adolescents matched perfectly for age and gender against what was originally done. And but my population had failed, most of them had failed multiple attempts at medication. So just to show you some of the different things that can cause ADHD, it's not created equal. So this is a study, and this is a kind of a confusing slide, so I'll go back to my next one. This is my current study. 1,233 people in this study, ages 4 to 72, 458 children, 314 adolescents, and 461 adults. And in these, losing the top of my screen here. Total children, 53% had the focal slowing. Spindling excessive beta was 22.3% of children and 12.8% of adults. On the on the encephalopathy, and then on the isolated epileptiform discharges, there was 33.2% of children. Isolated epileptiform discharges in teens were 23% and 17% for adults. So overall, if you take the entire study, 24.7% of all those that failed medications would have isolated epileptiform discharges, which an anticonvulsant should be considered, or neurofeedback, or a combination of the two. Encephalopathies pushing 10% overall. Spindling excessive beta, 25.1%. Of course, there's more in adults because I think they're exposed more than children. And then focal slowing, 53.4. So this is giving you a good idea that all these things that we see right here cannot be seen or cannot be identified in a psychiatrist's office, but it's critical for the treatment of the ADHD or for anything else that's bothering them. This is not just ADHD cases. These are all the patients in this 1,233, multiple diagnoses. But we know encephalopathy can create a slower brain and reduce the ability of the alpha to make its full range of speed that we want it to. And the isolated epileptiform discharges, one thing about them is that stimulants, antidepressants, SSRIs, SNRIs, and antipsychotics all make that activity worse. So by the time, with the way children are usually medicated in our world, at about 6 years old, they're usually hit with a stimulant because of their hyperactivity. By the time they get to be 8, 9, 10 years old, they got some repetitive behavior or some sort of OCD or anxiety going on, so they hit them with the SSRIs. And then by the time they bust into middle school and they start breaking walls and punching holes in walls and all this other kind of terrible behavior, they hit them with the antipsychotics. And I can't tell you the number of kids I've seen over the years that come in to me, they're on a stimulant, an SSRI, and an antipsychotic. And all the time that they were on that, they had these isolated epileptiform discharges. And that's just a sad way to treat. So you can't treat everything equally. So EEG analysis and QEEG analysis, identifying the underlying cause of the symptoms is critical to successful treatment. The EEG alone misses the serious etiology requiring medication intervention. Stimulants, that's why I want to make sure that everybody got that right there, that the QEEG, what most people in my industry they do is just the Q. They don't have the EEG read by a board-certified electroencephalographer or epileptologist. And if you do, you're going to miss the serious things that are going wrong with this person's brain. Stimulants only works with slow alpha subtype when it's not caused by encephalopathy. So slow alpha can be caused by encephalopathy, but if it's not, it's just slower alpha. That's the only one that works like that. Stimulants produce side effects in those with spindling excessive beta encephalopathy or isolated epileptiform discharges. Neurofeedbacks works best with focal slowing, anterior hypocoherent alpha, frontal midline theta. It works faster when combined with medication for those, including the isolated epileptiform discharge. Now, one of the things we have found since I've been doing this for so many years is that when we see a child that's 8, 10 years old and has this spike wave activity, this isolated epileptiform discharge is going on, and we put them on an anticonvulsant, their behavior improves dramatically. It's like a different child. They don't have the side effects or the dulling effects from it because we don't use those anticonvulsants. And then by the time they hit their senior year, the second semester, we'll do an EEG. And if they've got no spikes, we start the titration down 50%, no spikes, get them all the way off of it, no spikes, and the activity will never come back. It's actually kindled it out. So in psychiatry, this is the only medication approach that will actually fix something. And we've seen it multiple times, and I'm working on a paper on that right now. I do a lot of clinical research out there for this purpose. So does not work for neurofeedback, will not work for encephalopathy because you can't fix a breathing issue doing brain training. You can't fix a metabolic issue, a thyroid malfunction with that. So, and you can't get the mold out with that. So they're going to have a different intervention, a medical intervention. Let's talk quickly about genetic testing. A lot of people have had their GeneSight studies done. Genome, Genomine, GeneSight, they're all this basically produce the same thing. They analyze which medications, which actually can you process effectively without a side effect. They don't tell you what medication the brain needs, only what your body can process. And so people didn't realize that when they first came out about 15 years ago. Gene study does identify which ones they can process effectively. And then the GeneSight studies also identify a serotonin transporter gene issue. This is a very interesting one, and it's not noticed that often in these studies, but I look for it every time because if you have a person who has a need for serotonin and you put in an SSRI and there's no way to get it from the bloodstream into the brain, into the cell because it's missing the transporter gene, you're going to have to approach it completely different. Polymorphism for the serotonin receptor type 2 is another thing that it looks at. And this is, can it even make serotonin? And that's what we want to talk briefly. And I don't know if you guys have heard about this, the MTHFR gene. And I think that's one of the most important discoveries in the last 10 years that can affect everybody's brain. The MTHFR gene is an issue with folic acid. And it seems to underlie miscarriages, early heart disease or stroke between 40 and 70, and deficits of norepinephrine, dopamine, and serotonin is what is produced. Because the reason what folic acid is so important for, you cannot carry babies to term. They cut miscarriages down 30% plus in the 70s when they started prescribing prenatal vitamins to all women that are packed full of folic acid. Early heart attack, heart disease, and stroke, they've come to find out, is from the neuroinflammation, not from neuroinflammation, but from the inflammation in the arteries and veins. And so it's not cholesterol that makes the beaver dams, the widowmakers. It's actually the inflammation attracting fat particles that are floating through the blood and end up attaching themselves to the tight corners and crevices of the heart and the brain. And they make this, eventually it does stop all blood flow. And so that's how it affects them. And also, if you process through folic acid too quickly, you can't convert it to methylfolate. If you can't convert it to methylfolate, you can't get it past the blood-brain barrier. And it's critical for making norepinephrine, dopamine, and serotonin. Excuse me. So this is something everybody needs to know. If somebody's had a long history of anxiety and depression and ADHD, they're not making norepinephrine, dopamine, or serotonin in the right amounts. These three questions: has anybody in your family had a miscarriage? Does anybody in your family have early heart attack issues or heart issues, or anyone family have early strokes? If you answer yes to any of those questions, you likely have the gene, and you should be on Deplin, which is a prescription, or methyl CPG, which is a molecular supplement, the rest of your life. It will help you out a lot. You can start making your own brain chemistry and not rely upon the psychiatrist. So that brings me to the end of mine here. I'll be happy to take any questions. I know I gave you a lot of information in just a short period of time, but I think it's critical to understand the foundation of what causes ADHD symptoms.